to the Oregon Department of Human Services Self-Sufficiency Partners Meeting. We offer ASL and Spanish interpretation. Please use the interpretation icon below to select how you would like to participate in our meeting. We also offer CART transcription services, and you'll notice there's a link there for you in our chat as well. Self-Sufficiency Programs is committed to developing and deepening our partnerships to provide outstanding and culturally specific services and supports to the people in Oregon. This means listening, learning, and working together across ODHS programs and state agencies with the 9 tribes of Oregon, community-based organizations, and members of Oregon's communities. This virtual meeting occurs monthly and is a forum for updates, discussion, feedback, and Q&A about self-sufficiency programs and other related subject matter. This meeting is recorded so that we can share the meeting along with presentations and minutes to those partners who are unable to join us today. The follow-up email with all corresponding documents and links will be sent in 1 week. So I hope you don't mind that we do record. It's very helpful for folks who may miss our meeting for other conflicts and also for note-taking purposes. But if you have any concerns, do reach out and I would be happy to chat with you about that so we can find a better solution if needed. At this time, we do ask that you introduce yourself in chat. Please include your name, pronouns, organization, and role. This is helpful to us and to partners for connection purposes. I'm going to go ahead and put my information in now. All right, today's agenda is going to include an announcement and introduction here in just a moment, follow-up on Vision into Action, and information regarding the health-related social needs and climate support. Presenters, we do ask that you turn your cameras on while presenting where able, as our partners appreciate seeing the person who is speaking. Of course, we would also like to invite all those that are willing and able and comfortable to share your cameras as well. We love to be in community with you all, and seeing you makes that so much easier in this virtual space. So at this time, I would like to hand the mic over to Patty and Fred, who's our Chief of Strategic Planning, to introduce a very important person to you all. Patty.
Good afternoon, everyone. I have the honor of getting to introduce Jessica Amaya Hoffman. Jessica has been serving as the Interim Deputy Director for Self-Sufficiency Programs for some time and is now officially in that role. So we wanted to make sure that you all knew who Jessica is and have an opportunity to see her face. I also will just say I'm going to let Jessica introduce herself and talk about her depth of experience within SSP and child welfare. I will say Jessica is one of those people that I go to whenever I have any questions about service delivery or anything related to the work that's happening. So just know that she's a wonderful resource. So with that, I just want to congratulate and welcome Jessica and turn it over to you for a self-introduction.
Thank you. I'm always a little nervous when folks introduce me with such high esteem. Just that my own introduction of myself might fall a little short. For those of you that I've not had the pleasure of meeting, my name is Jessica Amaya Hoffman. I use she, her pronouns. As Patty said, I am the Deputy Director for Self-Sufficiency Programs, supporting our policy teams at this time. I am almost at 20 years with the Department of Human Services, which seems a little mind-blowing at times. It will be 20 years in August. My history has included 10 years in the child welfare program, and then I moved to the self-sufficiency program, and that's where I've been for just about the last 10 years, supporting service delivery and some of our administrative programs centrally. I helped with the one rollout during COVID, and then most recently was in District 2 before joining central office last year. So that is me in a nutshell. I look forward to having many more opportunities to connect with all of you. Really appreciate your participation in this community partner event that Misha helps coordinate for all of us, and hope that we can have time to connect with each other in the future. Patty, I believe I'm turning it back to you.
Or to Misha, I'm not sure
Or
either.
to
I will just add one quick thing though. For those of you that know Yvonne Lopez, I just wanted to make sure that you weren't getting the impression that Yvonne is going anywhere. Yvonne is the Associate Director of SSP, so she remains in that role. And Jessica is a much needed addition to the leadership team.
Thank you for that.
Okay, so Misha, I'll turn it back to you to see. I think we're moving right into vision into action. Is that correct?
Yes, we are. And actually, I have noted that, Jessica, you get to start us off. You've got the first few slides here.
Wonderful. Give me just 1 second. My computer crashed right before this meeting, so I do not have the my notes up in front of me. Give me just 1 moment.
And I'll apologize as well for my very overly active cat at the moment. And Jessica, if you need me to go ahead and jump in, I'm happy to do that. Or if you're close, we'll hold on.
I am there now. So sorry for that. Misha, can you or Patty, can you help remind me, is this team's first opportunity to see the vision into action, or is this an update for everyone?
Yeah, this is an update. So for everybody's awareness, 2 months ago in February, I came and talked a little bit. I didn't have a PowerPoint presentation, but and we've been talking about this over time, and I'll remind you about the timeline here later on in the presentation. But we kind of talked at that point about some of the key actions that we were taking. The exciting news today is that we do have the Vision into Action Guide completed. So we're going to hit some really high-level highlights, and then we can share the guide with you afterwards in the email.
Sounds great. Which I think is the first piece on this slide. We have been doing the rounds with all of our internal and external stakeholders to let them know that this guide is available. It's nice and glossy for the few folks who have wanted to have a printed out guide. I don't know about the rest of you, but it has been a while since I've had a printed out guide. I feel like everything is virtual these days. It looks just as beautiful online as it does in person. Can we go to the next slide? Hopefully you all have this information, but if you do not, the Vision into Action for self-sufficiency over this next year is our commitment to doing our part to end poverty in Oregon alongside state, federal, community, and our funded partners, as well as the 9 tribes of Oregon and the people that we serve. We know how poverty keeps people from achieving well-being and often is transferred from generation to generation. The Vision into Action really helps outline what our key strategies are over this next year. Next slide. Our top strategies for how we plan to put this action, or to put our vision into action, includes really making sure that we're connecting with community for integration and voice, family coaches offering tailored support to the families that they are serving, focusing on economic stability and concrete supports, deepening our collaboration with our system, program, and community partners and tribal governments, and engaging all of our staff, especially those within service delivery. Patty, I think you were going to talk us through our timeline. Sorry about all that fumbling.
No worries. So this, I'll just hit the highlights here. This is kind of the as you recall. So last summer, we came and shared with you the Vision into Action, kind of our high level goals. And again, just to kind of reiterate what Jessica was talking about, but a lot of this really came about because of a lot of transitions happening within self-sufficiency. So if you recall, we're still in the middle of that process of, eligibility transferring to the Oregon Eligibility Project, and some other changes. And so we really wanted to redefine what is SSP's role? What is our role going forward? So this is an interim strategy for 2024. So last summer, we shared the kind of high level with you. Last fall, you gave us some great feedback, and we'll talk about that a little bit later today. Misha will share that with you. That helped inform the development of the guide. We started by sharing the draft with managers in February and March. And then in April, we have the final guide available, and we're sharing it starting with you, with our staff. We haven't yet rolled it out to all staff yet, but that'll be coming very soon, as well as with tribal governments. So for the rest of 2024, this timeline just kind of shows how we are planning to implement. One thing that I will mention is that we're going to be doing a lot of work with our staff on helping them to be able to implement vision to action from whatever role they have in our program area. So whether you are administrative support staff, whether you're a family coach, whether you are, somebody who's working on policy, there's still a connection, and it's something that you can do. So we're going to be asking staff to really identify their own personal action plans within this work. Okay, let's go to the next slide, please. And this is another reminder. These are the 4 goals that we had set, and I'm going to just touch on them briefly. The first one is our bold, audacious goal of lifting people out of poverty. We're also using a summary of either ameliorating poverty, alleviating poverty, or ending poverty. This is really about helping people achieve economic stability so they can thrive and reach their whole potential. The shift here is that we're not only going to be serving people in crisis and helping them meet their immediate needs, but really transitioning to think about how do we provide the support that they need to make sure that they are moving from crisis to surviving to thriving. That's our goal. The second one addresses the racial wealth gap. We felt it was very important for us to acknowledge systemic racism that has resulted in large racial wealth gaps. And what that means is the barriers that are leading to poverty. So as we know, wealth is passed along from family member to generation, and so are often the barriers that are impeding people from achieving economic stability. So our vision is to really make sure that we are looking at addressing policies and the practices that have disproportionately impacted communities, particularly communities of color. The third one is really thinking about how do we shift from honoring lived experience, making sure that people achieve their goals to the extent possible, rather than us starting from, here's the goal that we are telling you that you're going to reach. So really thinking about how do we look at federal regulations and requirements, state regulations and requirements, and do a better job of making sure that we know how we can best support and work with the people that we're serving. And then the final one is just recognizing the unique needs, attributes, skills, talents, all the things that are unique to the individual, making sure that our services are flexible and provide trauma-informed, culturally respective, and that meet the needs of the individuals where they are. So those are our 4 goals. And I'm going to go ahead and go to the next slide, and then I think I'm turning it over to Misha.
All right, thanks, Patty. So, as Patty said, we got our guide officially, the final copy, and I wanted to take time to share with you just how the input that you provided this fall was included and utilized in this guide. So we did find that, just kind of on a side note, that many of the actions and priorities that you had brought up with us in the fall were also mirrored in the staff feedback. So it was really nice to see that alignment. So we'll start first with what's on this slide here, and that's seeking new and more flexible sources of funding for both individuals and for contracting with community organizations. Continue to collaborate with OEP to improve access to eligibility, including streamlining the application process and working with community partners to assist with the process. And next slide. Provide training on trauma-informed and empathetic interactions with the people that we serve. Ensure community engagement best practices are consistent and supported across districts and local offices. Improve individual and family engagement to include expansion of the family coach role. Listen and honor lived experience. Collaborate to ensure that people achieve their goals. And then we also have a goal around centering community knowledge. And with that, reasons behind that would be removing the responsibility and reducing the burden of community partners to navigate our complex systems across multiple programs, de-siloing various program community engagement staff, strengthening relationships internally between programs and externally with partners, and to remove barriers to service and programs. As I'm going through these slides, just to kind of reiterate, these statements are pieces we did pull directly from the guide. So these are action items that we have written in and are working with our staff on the best ways to implement at this time. So on this next page, we're talking resources. So providing culturally responsive resources by assessing gaps that we, as we contract, and improving self-sufficiency staff knowledge in accessing community resources for referrals. So with that would be like providing training with our staff so that they really know what's out there and how to access it. Our communities have so many wonderful resources out there, and it's really hard to know them all, but how can we help staff know that so they can work with our families better? Next slide, please. We would also like to find ways to strengthen and bring resources to communities and tribal governments to provide culturally responsive services, or I guess I shouldn't say also, but to increase what we are doing and do better with that. To address systemic policies and practices that have disproportionately impacted some communities, especially communities of color. Implement a comprehensive strategy encompassing inclusive recruitment practices, diversity training, onboarding, and ongoing education. Use the Office of Equity and Multicultural Services Equity Impact Analysis tool to identify impact and strategies to support communities. And last but not least, co-locate staff with community partners to help build connections. And so at this time, let me do a quick time check here and see where we are at. Oh, we've got lots of time. We're doing great today. Before we jump into discussion, I thought this would be a great time just to open it up. If anybody has any questions or any feedback on how your feedback was utilized and placed into our Vision into Action guide, that would be a great time to share that. And if you don't have anything, we'll move on to our discussion, but I just wanted to open it up for that. Does anybody have anything they'd like to ask or say? All right, I don't see anything now, but if something pops up, feel free to just go ahead and ask during this discussion, and that's totally fine. So we really wanted to chat with you today and find out from your perspective what you think the best way to measure success of these goals would be. What's a meaningful way to do that? So based on what we've shared today and the goals, the strategies that we're working on, how would you measure that? Do you have any thoughts around that? Because that is a piece that we are starting to work on. We want to make sure that we are moving forward with these and that we're checking on that to make sure, checking on the impact and making sure that it's moving forward and adjusting as need be as we go. And so, do you have any thoughts on that? On how best we could do that? No thoughts right now? It's all right. It stumps me too, honestly. I'm not really great with a lot of data. Definitely more of a feedback kind of gal. Beth, oh, I see hands. All right, maybe I should put those in front and I can see who's trying to ask questions better. So there we go, that'll show me. So Shannon, looks like you've had a thought.
Yes, so hi, my name is Shannon Olive. I am the founder and executive director for Women's First Transition and Referral Center, and we work to serve women transitioning out of prison and recovery from addiction and recovering from other trauma, helping them to overcome their obstacles so they too can also become successful and productive women of our society. And so, one of the things that our program criteria and for our organization is we most definitely are how we measure our goals is participation, engagement, and attendance. And so I don't know as far as what you guys your overview of what you just sent out, and that can be across the border of what just is your participants, people that you work with, and I don't know what things that you guys are looking to do as far as what your PowerPoint that you put out there. But I know what in the days in what we're it's kind of a challenge today because of COVID has really put people under put people under, and people are very complex. So it's really trying to figure out what things that people are really liking to do. How do you get people to even come and get involved and be more engaged to take action, right? But the thing is that it's most definitely once you get there, it's about participating, having them to participating and stay engaged, but then also attending too. When they do come, how are they attending and how they're staying engaged? And I feel like those three things, when we look at those three things in our program, is their participation. Once they get there, what are their engagement level looks like? And that also goes hand in hand with performance as well. And then once they performing, what is that that attendance goes as well with the performance, and then them that measures your outcomes, because whatever you're looking for them to do, that all go coincide with all of those three things: performing, engaging, and attendance. So I just wanted to put that out there for you guys.
Thank you, Shannon. Beth, did you have something for us?
Yeah, thank you. I wanted to raise a couple of issues, but just because Shannon I just want to also like lift up what she said and emphasize like that participation, I think, is really like the exact key point for measuring the effectiveness. And Shannon was talking about like a broad definition of participation, and then I'm also specifically thinking of participation in the programs, because there's a lot of people from various populations in Oregon that aren't participating that much in DHS programs that they really could benefit from. And I think the reasons why they're not participating are really, really important. And and that sort of leads me to my second point. And can I just say right before I even make my second point, I'm so sorry. I plug into these meetings when I can, and I know I've plugged into at least one discussion, but there's nothing worse than like finishing something, coming up with a plan, and then somebody saying, "Oh, you forgot something." So I don't mean to. I hope it doesn't sound like that, but I work for Oregon Law Center. We do a lot of work with people who are being accused of intentional program violations. And I cannot tell you how, by the Oregon DHS, I cannot tell you how many of those cases are really at their root. They're about how incredibly confusing the compliance rules are, and how they get, they may apply differently to different people. They all have slight differences by program, yet people who are investigated for program violations are really like, it's a terrible process, and makes recipients of SNAP and TANF and any of the other programs feel like it's dangerous to participate in these programs. And so I think I don't have a perfect suggestion right now, but I think measuring the effectiveness of your overall goals needs to encompass some, like maybe looking at the data for who is being found to have accused of and found to have intentionally violated programs, which programs are there, what support could be provided so that people are really better informed individually. And not just like once handed a piece of paper when they sign up for SNAP and then forever, told, we told you once on a piece of paper and now you didn't do this. And so we're accusing you of an intentional program violation, but maybe getting the data on who is being accused of and who's being found to have intentionally violated programs. And also just asking for some focus on that. And on letting people, like really supporting people to be successful in compliance instead of having people feel like they were trapped into being accused of an intentional program violation, which has lots of implications, sometimes criminal implications, sometimes immigration implications, but always has the implication of making people feel like it's dangerous to try to participate in these programs. So I'll stop there. Thanks for listening.
Thanks, Beth. I think it's important points to bring up for sure. I saw Patty, I saw your hand was up. Did you want to go next or should I go to Nikki?
Sorry, go ahead and go to participants first, and then I'm taking notes and I'll respond.
Oh, okay, great. I didn't know if there was an immediate response you needed. Nikki, what would you like to say?
Yeah, thanks, Misha. Just Nikki Carter, Director of Outreach for 211 Info for Oregon and Southwest Washington. And I kind of couple things like Shannon, I believe the first lady that was speaking, our outreach program, I guess to kind of answer your question on how to track some of the outreach things, and maybe some of this is already internally being done, but we internally like track and keep track of on a form that's an internal form of like all of the outreach that we're doing, whether it's emailing outreach, and sometimes it's more specific, like there's not a perfect like this is the process and this is exactly what we do, but in general at events, tracking who we speak to and then what those partner organizations are. But then I'm thinking there's so many of us different organizations that have an element of outreach that we're already doing. And I know Misha specifically with like ODHS CPCs and our 211 community engagement coordinators. In the last year, we've worked really hard to like grow the engagement and communication and collaboration between those folks, just to be able to share outreach and what we're doing and different and events and to connect with partners regionally and locally within our individual regions. And I feel like that has really improved over the last year and been helpful in tracking that goal when it comes to me, meeting with my team individually and going kind of over, are we meeting our outreach goals? Did we meet those goals last year? What did that look like? So that becomes a part of that like collaborative back and forth. And we don't just do that with ODHS, but we do that with a lot of other organizations that are already doing outreach programs in some way. But I think that's a key way to kind of look at that goal and the outcomes of those kinds of goals, just as an idea. And then I know Deanna's comment in here, like I totally agree with that as far as like being able to follow up with, and I know within 211, we have some, closed loop type programs. And I know a lot of agencies do that are providing some of that more in-depth case management type referral program, as opposed to just, giving, folks direction and then sending them on their way. And so that's where we, at least at 211, are able to see some of that follow-up information or that post information to see, how relevant the programs have been for people who have at least accessed it, of course. And we know there's still a lot that are eligible, like someone else had mentioned, and are maybe not accessing the services for a lot of different reasons, as we all know. But just, I guess, I feel like I'm forgetting something too after listening to everybody else's suggestions, but that's what I can remember off the top of my brain.
Thanks, Nikki. I would be very interested if it was easily shareable how you are tracking on 211. I know you do a lot of engagements in the community, and it's a pretty vast amount, really. And so it'd be great to see how you do that.
It is. Like we use Google Suites, the enterprise or the business version of that or whatever. So we do a lot of, not a lot, because it can get to a point to where like, oh, another Google form, wonderful. And everybody's like not excited about that again. But for that tracking of that specific, data point within our internal team, that's the form. And I'd be more than willing to like share the format of the form and what it collects. And then we change it each year. And like, it does get really, really long and in depth. And we have some internal team that then helps create kind of like heat maps in a way, so that we can look at the state and kind of see, oh my goodness, in Central Oregon, which is where I happen to live myself, but I work around the state. The last year, let's just say there was 300 events that we attended, which, and so we can create different data metrics, I suppose, in a way to report back on some of that information. It really just depends on what we're after and what we want, but yeah.
Thank you. So I know, Patty, that you wanted to be able to respond a little bit. I did want to do a bit of a time check because we're at the end of our time now. So, but I want you to be able to respond. I just want to throw that out.
And I'll try to be really brief. I just wanted to, first of all, say thank you. I think the feedback has been tremendous. And I would just echo everything that Shannon, Nikki, Beth, and Deanna have said. And I think the way I'm thinking about this is kind of three things. One, there's the process, and a lot of what you'll see in some of our actions were process oriented. So I think that's to your point, how we've made our processes too complicated, right? How are we working to change that so that we can actually provide access? And Shannon, to your point, I mean, I think a lot of it is, okay, how are we working to engage people and, and make sure that we are looking at who's participating and who's not. So a lot of what you'll see is kind of process oriented, and we'll track all the actions we put in the guide and make sure that we're moving forward. I think the bigger question that is going to be a lot more difficult to measure is outcomes. And Beth, you talked about that. Deanna, you talked about that too, about tracking outcomes after people have left the program. Have we actually made their, are their lives actually better? Are they economically stable? That's going to be that bigger piece that we want to measure. We're not going to accomplish it all in 2024. And as I said, this is an interim plan, but we want to make sure that we're moving in that direction. I won't call out Dwight. I know he's on the call here. Dwight Palmer is our service equity manager for self-sufficiency. And at some point he'll be coming and talking with all of you about an equity dashboard that is coming. And that's where I'm hoping we can do a lot more of the tracking of those outcomes. And then the third piece is really that collaboration. So, some of you have mentioned, like Nikki, you mentioned, how you're tracking community engagement. We'd love to learn from you and figure out, are there ways we can collaborate on how we're tracking our respective work. So I know we're out of time, but I'll just put that out there. Final comment, Beth, to your comment about, we really are continuing to look at this as an iterative plan. It should never be something that's done and we close the book and then we're done. We're never going to take additional feedback. So as we're working through it, we are absolutely intending to update it and make changes as we get feedback. So appreciate that. And I'll turn it back to you, Misha. Thanks everybody.
All right, thank you. I know we all appreciate your feedback, and just want to encourage that if you think of something that you didn't say or that you wanted to say, please let us know, and we'll put the email for Vision into Action in a chat here so that you can respond back to us if you have some thoughts afterwards, because we would like to be able to hear from you and gather that feedback so we can move forward with it, and certainly hope that you feel heard with the feedback that you provided, this fall, and that we really did take that to heart and include it in this guide. And we will include a copy of the guide in the follow-up, so you get a chance to really dig in. Today was a very high-level overview of, some of the statements that were made in the guide. But if you're curious, how's that all going to happen? We'll have that guide in the follow-up for you to take a look at if you'd like to dig in a little bit further. So with that, We have a presentation next on health-related social needs and climate support. So I would like to welcome Jessie and Sharisa, who are going to present next.
Hi, thank you, Misha, and thanks for having us here today. My name is Charissa Young-White. My pronouns are she, her, hers, and I am with the Oregon Health Authority on Jessie's team, the waiver team for health-related social needs.
Hi, all. Jessie Wilson, she, her pronouns, and I'm the 1115 Waiver Strategic Operations Director with the Oregon Health Authority. I'm happy to be here. I know Amelia Reynolds, our climate lead, was going to present today, but she was unfortunately unable to make it. So I'm standing in presenting climate, but knowing that I will probably not do it justice like Amelia as our expert, but glad to be here. Thanks.
We can take any questions back. I'm going to share my screen in just a second, but I just wanted to give a little bit of context for what we're talking about here today. So we are talking about a benefit or an entitlement that Oregon Health Plan members will have when if they are in a covered population and meet other eligibility criteria. I realized we didn't put those slides in the slide deck. So I wanted to talk a little bit about the goal of health-related social needs and the program. So we are currently live with climate-supported devices, which we'll talk about in a minute, Jessie will, and with outreach and engagement services that community partners and other folks that want to sign up as a service provider can provide those services. So that's sort of the basic what we're talking about today. And in the future, we will have other benefits like housing and nutrition in November of this year and January, respectively, 2025. So more to come on that, and I hope we can come back as well. So we're just going to do sort of a high-level overview today and then point you to some resources. But I would love if you reached out to me. Jessie, I'm sure, is very willing as well, and anyone on our team, and we can help do this, answer questions or present in more detail on certain topics if you'd like as well. We also have technical assistance sessions and partner work sessions, and we can get you linked up to that if you find anything of interest here. So just wanted to do that really quick. I will share my screen now, and we will talk about the specifics of this benefit. So I actually kind of covered this one, but I didn't realize that I could have shared my slides. But we planned last year, hopefully engaged at least some of you on this call, if not a lot of you. And we have gone live with climate-related supports, like I said, and associated outreach and engagement services, which we'll talk in just a minute. And then there's the rest of the timeline that I touched on there. Jessie, I'm going to turn it over to you for the climate.
Great, thanks so much, Charissa. So just a reminder to folks, these we're talking about health-related social needs services, which are now covered Oregon Health Plan services as part of our 1115 Medicaid demonstration waiver authority that we received from the federal government. And so we are in a demonstration here and implementing these services with the hopes that we can continue these as a permanent service under the Oregon Health Plan moving forward after the demonstration. So the first HRSN service that we've launched is the climate benefit. We launched this service March 1st of 2024, and it includes air conditioners, air filtration devices, mini fridges, portable heaters, and portable power supplies. So these are the 5 types of devices that we're authorized to provide eligible individuals under this new benefit. Next slide, please. So let's talk about who is eligible for these new services. So they are a covered benefit under the Oregon Health Plan, but unfortunately not everyone on the Oregon Health Plan will be eligible to qualify for the HRSN benefits. There are some layers of criteria that members must meet. So the first one being on the Oregon Health Plan. The second one, they need to be part of one of the eligible groups that are outlined on this slide. So an individual who has been discharged within the past year from a mental health or substance use disorder institution for mental disease. an adult or youth released within the past year from incarceration, an individual who has been involved in the Oregon child welfare system at some point in their life, an individual who within the next 3 months or the past 9 months has transitioned from Medicaid only to dual coverage, so receiving both Medicaid and Medicare coverage. Individuals who are homeless or at risk of becoming homeless per the HUD definitions. And then a young adult aged 19 through 26 with special health care needs. I want to highlight that this eligibility population will not be eligible until 2025. So members need to meet eligibility, need to qualify as being part of one of these eligible populations. And the reason behind this is that the authority from CMS allows us to offer these services to individuals who are experiencing critical life transitions. In addition to being an OHP member and being part of one of the eligible groups I just mentioned, the individual also needs to meet some other eligibility criteria, which we'll go into in the next slide. So this slide illustrates the framework that I'm speaking to. So the first one being that they are a current OHP member, they're part of one of those eligible groups that I mentioned on the previous slide. The second layer is that these individuals need to have a clinical need for a specific climate device. So that's one of the requirements from CMS on this new benefit, is that these devices have to be considered clinically appropriate in that they're helping the individual prevent further exacerbation to a certain health condition or help treat a health condition. The third is that there needs to be a social need for the device. We've tried to simplify this eligibility criteria to ultimately be, does the member not have a climate device that's meeting their needs? And can they safely use that device where they're living? If so, they meet the social need criteria. I'm going to pause for a second because that's a lot of information, and let's see if we have any questions in the chat, Charissa, that we should address now.
So the question in the chat was just about the slides, and yes, you will get the slides. Misha has them. I think I sent them to her, so I think you'll send it out with everything later like you talked about. Yep, you will definitely get them.
Great. Okay, let's go ahead and go to the next slide. So we covered eligibility for the new benefit. I want to talk about some of the limitations, and these have really come out of frequently asked questions that we've been getting when we engage partners and members. So I want to make sure to clarify. So members, to qualify, there needs to be some reasonable efforts made to determine whether in the last 36 months, the member has not already received the same climate device that's meeting their medical needs. And this really comes from the requirement that we can't supplant or duplicate any existing services that the member may already be receiving. So if they already received an air conditioner in the past 36 months that's meeting their needs, they would not be eligible to get a new air conditioner through this program until after that 36-month period. And that 36 months, if you're wondering, where does that time period come from? That's really in alignment with typical warranty periods for devices. The second thing I wanted to call out is that about replacing filter for the air filtration devices. We've learned from other climate programs that this is an essential piece to success, that members need to be able to have replacement filters for these devices. So they're eligible for up to 3 replacement filters for every 12-month period once they receive that device. Device failure, we get a lot of questions around what happens if the device fails. Most of these devices should include at least a 1-year warranty after delivery of that device. So if outside the warranty period or the damage is not covered by the warranty, then we are really expecting coordinated care organizations, CCOs, to replace or repair that device for the individual as long as that individual is still eligible for the device. Utility costs. We get a lot of questions around utility costs, that maybe one of these devices is going to increase an individual's monthly utility bill. Unfortunately, under this new benefit, we are not allowed to pay for utility costs for these devices. However, CCOs may be able to support these increased utility costs under what's called flexible services or health-related services. And there may be other programs as well that are available, but unfortunately, this does not cover utility under this new benefit, utility costs. Next slide, please. And so this slide, and I'm probably getting close to time here, but just wanted to include the member steps at a glance. So capturing what is the member's experience likely to be going from needing to access the device to then using the device. And so we expect that this is the journey, so to speak. That the member can learn about different options and get started. And so this is one of the reasons why we are doing these presentations, so that our partners, our interagency partners, can learn about these benefits and help us educate and share the information. The second step would be there needs to be a screening process that happens to ensure that the member is eligible for the services. We would expect the CCO or our open card contractor, etc., to complete that screening process and authorize the service. And then once that service is authorized, the CCO or open card provider, known as etc., will tell the member that they're eligible for the climate device and what to do next. The member then would receive the device. Typically, they get direct shipped to the member's home. If installation needs to happen for like an air conditioning unit in the window, then the CCO would arrange for that. And then the member will be able to use the device, and if needed for any issues, know where to go to seek help for that, typically with the CCO or the open card provider. Next slide, please. And so this slide just highlights some of the resources that are available on these new health-related social needs. We have several web pages here. We have a newsletter you can sign up for to receive bi-weekly communications on this benefit. And then we have different forms that may be used by our partners to help members access these services. I do want to highlight a couple of things on here. The member journey, so on the bottom of this slide, HRSN member journey, that goes into much more detail than what I just covered on the high level steps of the member journey. We have that in English and Spanish, and so folks can check that out to learn more. We also, on the other side, have the HRSN provider journey in English and Spanish, which details the steps a provider would likely experience in helping members providing these services to eligible members. There's some other resources on the slide as well if you want to check them out, the fee schedule for these services, and then a fact sheet as well. Next slide. Any questions on the climate benefit before I turn it over to Teresa?
We had a couple in the chat, Jessie, and I'll ask to make sure that I answered them correctly. I wrote a little bit in the chat to make sure that was documented, but Beth asked that, quote, I understand that CMS required that there actually be a climate emergency in order to trigger eligibility for this HRSN. Did that change? And I said it's not triggered by an by a climate emergency. That's actually not the intention, but I didn't know the history with CMS. So if you wanted to speak to that.
Yeah. Great question. So that was, previously there was another eligible population, individuals who reside in an area experiencing extreme weather, extreme weather event as declared an emergency by the federal government or the governor of Oregon. Because of the operational challenges in implementing that program requiring a federal emergency, which is pretty rare for specific climate events, that is no longer an eligible population for this benefit. So there is no requirement to have a declaration of emergency. Eligible members can access these services anytime. So if it's winter and they know that, well, I'm going to need an AC before summer, they can qualify and get an AC in the middle of winter, so they can have that by summer. So not tied to a declaration of an emergency for a weather event any longer.
And then Jesse, there's a couple questions about this. And I answered a little bit in the chat about self-attestation, but maybe you want to speak to that. You speak so well to the self-attestation piece and what is required.
Yeah, so a lot of the eligibility criteria, we are relying on member self-attestation. That is to ensure that we have a trauma-informed approach, as we don't want folks to have the burden of having to, prove that they necessarily are part of one of these transition populations. As we know, that can be traumatizing, and really our goal is to serve individuals. So self-attestation for HRSN eligible populations is acceptable, as well as meeting certain clinical risk criteria. An example, like a specific example for self-attestation is like if an individual's experienced interpersonal violence or intimate partner violence, then that is something that we would not expect to have some sort of medical claim or documentation in a medical record. Self-attestation in these areas is crucial to ensure that folks can access these services. Let me know if that answers the question or if there's additional nuances needed.
And then specifically, Jennifer asked about child welfare, and absolutely. For outreach and engagement, which we'll talk about for just a minute in a second, we do try to identify these folks to proactively reach out. But if someone, and this is at any point in their life, they've been involved in child welfare in Oregon, so they could be 63 years old and have had a case when they were 3 years old, they are eligible for this benefit. And again, though, we are relying on that self-attestation that Jesse was talking about. The only time the CCO or health plan would deny would be if they actually had hard evidence for whatever reason that there was a mistake or something there. So,
that's right, Teresa. Sorry, did I cut you off? I was just going to add, absolutely correct. The health plan, so the CCOs should absolutely accept self-attestation unless they have information that would suggest otherwise, that the individual is not eligible for the service or has already received a similar service that's meeting their needs, and it would be duplicative. Misha, I see you have your hand up.
Yes, we're actually over time right now, and I know there's a few more pages left. So what I wanted to just let folks know, I don't want to cut your presentation short, is just a reminder that we are recording today. So if you, because we're a little over time, if you need to leave, it's okay. We will be sending this recording out so you can watch the end of this presentation. And of course, it will be in the minutes as well. So I just want to throw that out there. Do want to respect your time, but also know this is really important information that I know you're curious about. So don't feel bad if you have to leave right now. I just want to throw that out there because it is being recorded. So we'll get that out to you next week. All right, I'm going to hand it back to Teresa.
Thank you. And I'll just take 2 minutes. We'll just stay on this slide for a second. If you are a health-related social needs, or I'm sorry, a community partner, an organization that is interested in becoming a health-related social needs service provider, this is really important to you. This stuff is not really member-facing, because what we're really hoping is that our service providers and our health plan partners, CCOs and Open Card, will be outreaching and engaging, so the outreach and engagement benefit, to our members in these transitions populations to help connect them to these needs. And the best part of this is we can pay for that outreach and engagement, so we can reimburse. But this is really only for those folks, those partners, community-based organizations or otherwise, that have signed up to become an HRSN service provider. So I'm just, at this point, I think the best thing to do is leave you with a these are some activities that you can do and actually get reimbursed for through this benefit with Oregon Health Authority for Oregon Health Plan members. And I will put my email in the chat, and you can absolutely reach out to me anytime you have questions. And like I said at the very beginning, we have a lot of technical assistance and partner sessions that can really help you understand if being an HRSN service provider is the right thing for your organization. So it's 3 o'clock, and I think we just hit it. I will paste my email in the chat right now, and I just thank you for having us here today.
All right, thank you so much. Sorry to rush you. We always fit a lot into these meetings. I just a note for those of you who are still on the call, there was an announcement that I know Comms was hoping I could get out to y'all today, but we are over time. So take a look at the follow-up email that comes out next week. It'll have information and presentations that you heard today, as well as kind of a summary of the feedback and any of the Q&A that happened, as well as this announcement about some different tax credits and things, just reminders of things to kind of help folks know about so that they're receiving some of the tax credits that are available as well. So I'll just send that in the follow-up so that you have access to it. Have a great day and month, and we'll see you again in May.